When I'm thinking about bone graft materials to use for this specific patient, I feel confident about using the Grafton materials because of the evidence that supports their effectiveness. The clinical effectiveness of bone graft materials is really critical to informed choice. And again, my confidence in the Grafton product line is based on more than 25 years of clinical experience, as well as a significant peer-reviewed literature suggesting effectiveness of the product line. That peer-reviewed literature includes preclinical studies looking at osteoinductivity and comparative studies, as well as clinical studies. One of the important clinical studies that supports my decision to use Grafton is the work that was published in 2012 in Spine by Kang and others. And in that work, they did a randomized comparison of posterolateral fusions, single-level surgeries, looking at patients with Grafton and local bone posterolaterally compared to autograft alone. And in fact, they were substantially equivalent. And that suggested to me that Grafton could be quite effective as a bone graft extender in the posterolateral space. And that really is the basis for my confidence in using the product with my patients.